Well, hello. My name is Jodi Scholes, and I'm your instructor for the MBLEx review course. Welcome. Welcome. So glad to have you guys here. Wanted to recognize today that we are studying pathology, and pathology is about 14% of your MBLEx. And so about 14 questions are going to be on pathology, which technically is dysfunction or disease of the body. So it's not just internal diseases, but we'll cover this. We'll take a broader view today on what is pathology. So what could you be tested on? That our class happens in three segments. Our first segment is some test taking strategy, some inspiration, some motivation, some insights into the MBLEx. Our second part is the learning. So many of you already have all the learning that you need to be successful with this test. However, there are some little things that we can polish up on, right? Call it polishing the diamond. And then in the third part of our class today, we're going to be dissecting questions. So let's get into it. Today, I wanted to start with a quick success story. I've invited someone to share a few words, and this is CJ. CJ's been in our classes, but CJ's with us today, and she has some news to share. Miss CJ, would you like to take the floor?
Thank you so much, Jodi. It is so exciting to finally be able to say that I passed the MBLEx. Thank you so much for all of your help. It was my first time taking it, and if it wasn't for you and your course and all of this incredible community, listening to all these stories, listening to all of the challenges that people face, it really helps so much. I cannot thank you enough for everything that you and your team have done. Y'all have been incredible. And I look forward to moving on to the next chapter, which is your business course and the alumni and just, seeing what happens for the future. But if it was not for this course, I know that I would not have passed because it wasn't clicking. It wasn't there in terms of the detail that I needed. And all of those tips and tricks that you provide and your course is phenomenal. It's so easy to navigate. And I just, every time I came together within this community, it was so motivating and so, uplifting for everybody to discuss their successes and their challenges, which I can't thank you enough. So thank you very much.
Oh, you are so welcome. CJ, thank you for making time. I know you've got a meeting that you're going to
Yep.
be scooting off to, but overall, I mean, when you were in the test, what did you feel? Did you feel like, oh my God, I'm failing? Oh my God,
I
I
thought,
got
yeah, for
this?
sure. I thought for sure I was failing. I was like, I don't know this stuff. I decided to get into this to help myself and because I had dealt with some health issues and I thought it would help me learn more about my body. And then it evolved into other things. And when I was taking the test, there were some things that were like, okay, I've got this. And then it got harder. And I was like, there's no way I passed. I was like, it's okay. Other people have, had to take it 2, 3, 4, plus times. And when it's your time, then it's your time. And I'm thankful that I stuck through and I listened to what you said about, picking out those distractors and making sure that you were focusing on, those roots of the words and all kinds of different things that you taught us. So it was very helpful. Thank you so much.
All right. And so you saw the words congratulations at the end of your test. How
I
did you
did.
feel?
Oh, I was just elated. It was like a weight was just lifted and it just felt like there's something else coming. I'm not sure what that is, but it felt phenomenal and I was just so grateful and thankful.
Awesome. Awesome. Well, thank you so much for sharing your story.
Thank you.
The idea is that by hearing your story, everybody else in the classroom today is going to be like, that's me.
It
That's
is
me.
you. Just
Yeah.
make sure that you're focusing on the positive and see it in your mind that it's going to happen and it will happen. And just if for some reason it doesn't happen initially, just keep going and you are going to move forward and you will succeed eventually. So I wish
Mm.
everyone the best and I'm so thankful for all of y'all. Everybody in this community. It's been amazing.
Yeah. When the energy comes together,
Oh yeah, definitely.
we really, it's
Yes.
like, okay, I'm not in this alone. I'm not
Yes.
not in this just by myself. There's other people who
Exactly.
are tackling this. Yeah.
Yes, it really is amazing to for people to really share those things, especially when they're going through that situation, and especially if they hadn't passed the first time. That helped me a lot. I mean, for someone to have the courage to be able to speak about that and to speak about how that felt and what to do next in order to help improve. We can't go into details specifically about the test, but I mean, the things that they were talking about, what they did, and what you also said to do to focus on, moving forward. And you've got this many days to, to feel that feeling and move past it. And it just, yeah, it was great. It was really, really phenomenal.
Yeah, and I want to just one last thing. I want to mention that after we talked, we had someone who came to speak that they had passed the test, but there were a couple people that week who hadn't passed the test. And I had mentioned
Yeah.
something that resonated with you. And that was about shame. You, and you had said,
Hmm.
please make sure that that message stays in
Yeah.
the video. Because,
Yes.
when we feel this burden, this
Hmm.
weight, and so often I hear graduates say, oh, I've got this weight, you know,
Just,
um,
yeah.
yeah,
Yes.
and you can take that weight off, but also some of that weight is the opinion of others.
Absolutely. Absolutely. Yes. And when I had heard that, and when you mentioned that, I was like, okay, well, if I don't pass, then I know that the next time I'm definitely not going to put it out there on when my test date is or anything, because I just needed that to be for me, aside from, our community here. But yeah, it definitely was helpful. And that weight was lifted 100%. Yes.
Yeah, yeah. Oh, well, thanks again for sharing your
Thank
story.
you so much.
I really
Thank
appreciate you taking the time today, and we'll be in touch real soon. I hope you found that inspirational. I hope you found that to be motivational. And that's also, if you're comfortable speaking in front of the class, that also can be your path when you pass to come in and have a word with us. Um, and to know, I'm going to just remind you here with our view. You're not alone. Look at this. We're all here studying. We're all here preparing to pass. We're at different stages with different experiences, but when we come together, our combined energy is even stronger. And so let today be an anchor for you. Let today be something that you can say, okay, yeah, even when I feel like I'm screaming into the wind, you're not. You're not alone. You've got this community to fall back on. Yeah. So, but you are going to need to know a few things to pass the MBLEx. You ready? And away we go. Yeah. So, today's course is on pathology. What do you need to know? There are so many things out there to study. How in the world do you know what you need to know? Let's go through it. Welcome back. Here is what the Federation of State Massage Therapy Boards tells us that could be on your MBLEx. As I've mentioned, it's 14%, which means 14 questions out of 100 will be on pathology. The Federation tells us there's an overview of pathology, whatever that means. We'll talk about that in a minute. You'll need to know contraindications, site-specific, body part-specific contraindications. Also, we'll talk at another time about special populations, tools, areas of caution. Uh, and there's a longer lecture on special populations in your online learning center under client assessment. And then there will be classes of medications. I want to just address that momentarily. We no longer need to know brand names. We need to know the types of medications. So is it a pain reliever? Is it a muscle relaxant? So those categories, those classes, no longer do we need to know the names and the class or the names and the category. So, but today we're here to talk about pathology and a very specific part of pathology. I like to review what massage schools could have covered. This particular syllabus that you're about to see, the next 3 slides, is from a program called the ELAP, the entry-level assessment program, where 7 organizations came together, AMTA, ABMP, NCB, and a few others, came together and said, this is what we would like to have in massage school. Bones, postural deviations, osteoporosis, fractures, arthritis. So these are pathology of the bones. Understanding pathology of the joints. All of these 10 conditions could be affected by massage therapy. And so to be familiar with those conditions. Pathology of the connective tissue. So we haven't even talked about internal organs here, right? We think of pathology as disease, like maybe diabetes or fibromyalgia or, diseases like that. But these are also conditions that could compromise bones, joints, connective tissue. These 9 pathologies affect the connective tissue. Pathologies of the muscles, muscular conditions. These 8 pathologies affect the muscles. Mm-hmm. Mm-hmm. Yep. You see how we're working through body parts here? So there are some mental disorders, which are a part of pathologies. So we have physical pathologies, we have mental pathologies. These are some mental disorders, names of them. And also the gastrointestinal conditions. There are several pathologies of the gastrointestinal tract. These 11 are names to be familiar with. So in the beginning of this particular class, we talked about what the Federation, the FSMTB, what the Federation has told us is on the MBLEx. They start with an overview of pathologies. Well, we will need to be familiar with an overview of pathologies for each part of the body systems. So we have 10 body systems. Technically 11. I was going to say, it's not that easy to remember 10. It's actually 11. The one that's not on here is lymphatic or immune. So there's actually 11 different body systems. And so being familiar with pathologies that affect each of those body systems. Today, we will endeavor to identify and define a few gastrointestinal conditions, ones that you may not be 100% familiar with. So we're going to focus on the gastrointestinal tract. So we're going to cover diverticulitis. We're going to talk about Crohn's. We're going to talk about hiatal hernia. We're going to talk about polyps, colon cancer, and a little bit of irritable bowel syndrome. So we only have so much time, but I want to take a deeper dive into those conditions. So let's get started with diverticulitis and diverticulosis. Remember, we've made these distinctions in the past between itis and osis. Itis is inflammation. Osis is chronic condition. Lots of people entering the weight room. All right. Diverticulitis, itis, inflammation. Osis, chronic condition. So let's start with the diverticulitis. So this is our colon, a segment of our colon. And within that colon, there are small irregular pouches of the wall of the intestine. So the large intestine. So we call the small and the large intestine, that whole thing, our colon, but really it's the large intestines that is the colon. And so inflammation within the colon. So inflammation and complications of these diverticula, excuse me. Um, so diverticulosis here, we'll talk about it in a moment, but you can see the itis, right? So diverticulitis, inflammation. So these diverticula are small sacs in the large intestine that become inflamed. So technically, it's an inflammation of irregular bulging pouches. So typically, the wall of the intestines is smooth. It doesn't have these kind of bulging pouches. Um, and when you've got a group of irregular bulging pouches, um, they're called diverticula. One little one is a diverticulum. So you might see these changes in the words, these changes in the end of the words. So just be careful on the MBLEx that you see itis, you see osis, you see a diverticula. Be very careful about what they're asking you from. They're all in a similar area. They're all in the colon. They're just at different stages. Yeah. So many people have diverticula, but they have no symptoms because they're not isis or osis, right? It's very common, actually, for people over the age of 50 to have diverticula. So little bulging, irregular pouches in their colon. They're found in the lower part of the colon, but usually they don't cause problems. Yeah. So the presence of diverticula is called diverticulosis. That means you've got some diverticula in your usually descending or lower part of your colon, lower part of your large intestine. Now, when they become inflamed, there we go. That's diverticulitis. So, what is it exactly? The inflammation is the immune system that brings some blood flow to that part of the body and delivers some disease. They think it's disease. So disease fighting cells and the inflammation of that, the diverticulitis can cause changes in your stool. So changes in how you poop. Stool is poop. If you see changes in your stool, that's changes in how you go to the bathroom, how you excrement. Diverticulosis can also cause some fever, some nausea. It can cause a lot of pain. In fact, the pain can be so much that it actually keeps people from going to work, keeps people from going to school. Um, mild diverticulitis, you can relieve with rest. Um, Sometimes antibiotics help, sometimes they don't. But again, just to be clear of what the diverticulitis is, it's irregular, inflamed sacs in the large intestine, usually the lower part of the large intestine. Now, severe diverticulitis can lead to hospitalization. And unfortunately, if it is not under control, it can lead to surgery. It's very, it's unusual to need surgery, but if it is severe, if it is chronic, if it is frequent, then there's possibility of what's called resectioning of the colon to remove the inflamed part. That's in very severe cases. So if a client is to come to you and say, hey, I've got diverticulitis, we need to know, where are you in that cycle? Is it mild? Is it moderate? Is it severe? That would be the best case. And so for your MBLEx as well, if they're saying, okay, your client presents with a case of diverticulitis, you need to know moderate, mild, moderate, or severe. Also, massage is contraindicated during a flare-up. They're in too much pain anyhow. Yeah. So if they're having a flare-up, they're not going to be interested in massage. They're going to be feverish, another general contraindication. They're going to be nauseous, another general contraindication. Yeah. Again, as with so many cases, the answer is it depends, right? It depends on mild, moderate, or severe, but we're going to, for the purposes of the MBLEx, be conservative and assume that it is a severe case, unless you are told otherwise. All right. This is diverticulitis, and I wanted to give credit to the Mayo Clinic who offered some of these beautiful pictures of what it looks like. Oops, that's backwards. All right. Diverticulitis, diverticulosis. Osis is not a disease. Itis is considered a pathology. Let's move on to Crohn's, shall we? Because these two can easily be confused. It's like, oh, I know it's in the, it's part of irritable bowel syndrome. It's part of, having irritable bowel conditions. Let's take a closer look at Crohn's, shall we? We're still in the gastrointestinal tract. So Crohn's typically is associated with abdominal pain, with diarrhea, with some cramping, definitely cramping, and in a progressed state can lead to ulcers of the digestive tract. So ulcers in the stomach, ulcers in the small and large intestine. Crohn's disease can lead to that if left untreated. Now, Crohn's is a little bit of a different beast because it can affect, I'll go back to that slide in a minute, but Crohn's can affect anything, can affect different areas of the digestive tract from the mouth all the way to the butt, all the way to the anus. So that's why you see all of these areas that could be affected by Crohn's. They may experience mouth sores. Because of the lack of absorption of nutrients, they may experience malnutrition. With most cases, you can control the symptoms of Crohn's. There's medication. We see it advertised, but typically with a change in diet and a change in their exercise routine, Crohn's can be controlled. Typically. Now, take a peek. This is another. So even though it can affect different areas of the body, Crohn's is known for affecting segments of the colon. You'll see here the healthy segment and then red, an inflamed layers of the tissue on the intestinal wall. And then you see an unaffected part and then an affected part. And again, this is the large intestine. This is the small intestine. Yes. So this is specifically where most people experience Crohn's disease. In the intestinal tract, different sections are affected. How do you treat it? Change of diet, change of exercise routine, and sometimes medication. Lots of times medication. So with Crohn's, it comes and goes. They could have like the client could have their very first flare-up be severe, but it is not always omnipresent, meaning it's not always there. People are not always being affected. In fact, there's long periods of time, sometimes years, where people who have had a flare-up of Crohn's disease feel fine. However, if they come under stress, if their immune system is weakened, then Crohn's can flare up. Yeah. And as I mentioned, they'll feel terrible. They won't be able to go to work, go to school. If you think that your client has this condition, it is time to refer them to the doctor that handles these conditions, called a gastroenterologist. So the gastroenterologist, gastro, stomach, enterologist. So the gastrointestinal tract is what we're talking about, and a gastroenterologist takes care of that. All right. And credit to the CDC for the great pictures. Thank you very much. This is Crohn's disease. All right. We've touched on irritable bowel syndrome. That's kind of a blanket statement, an umbrella statement that can be a number of different conditions, and it could be if someone says, I have IBS, we're not sure what's creating the irritable bowel syndrome. So let's move over to the hiatal hernia. How many of you know what a hiatal hernia is, huh? Hmm? Hmm? Okay, let's take a look. So hiatal hernia actually is a part of the stomach condition. And when the stomach pokes through, bulges through that large muscle that separates the abdomen from the chest, the diaphragm. So there's a little hole where the esophagus goes through. Let's see a bigger picture. So the esophagus here goes through this little hole called a hiatus. And the esophagus is the tube that swallows our food. Goes through the diaphragm, through a little hole, that little hiatus, and into the stomach. All right. Time to dissect some questions about our gastroenterology tract, about our gastrointestinal tract. Oh, actually, about pathologies of the gastrointestinal tract. Ready, Freddie? All right. The tube used for swallowing food, called the esophagus, passes through a small opening in the diaphragm before connecting to the stomach. When the stomach pushes up through that small opening, it creates. Good. Next question. Your client writes down that she has a condition called diverticulitis. You recognize that condition as blank. As what? A. So your client writes down that she has diverticulitis. And you recognize this condition as A, a single pouch in the stomach wall. Symptoms occur when inflamed. B, multiple pouches in the colon wall, not inflamed. C, multiple irregular bulging pouches in the colon wall. Symptoms occur when inflamed. A singular pouch on the stomach wall, not inflamed. So what is diverticulitis? I see answers coming in. Let's eliminate one wrong answer, okay? Let's eliminate a distractor, what we call. So it looks like it might be right, but it's not quite right. So let's eliminate single pouch in the stomach wall that's not inflamed. Because you see this, itis. All right, let me check this. Let me check the. Checking the chat. All right. Diane nailed it. Good. Kesha, yes. Maria, yes. Greta, got it. Brienne, you got it. Pumbla, yes. Jessica, uh-huh, uh-huh. Rico, yep. Ms. V, got it. iPhone, yay. Patithia, yep. Brianna, yep. Brenda, yep. Oh, you guys weren't fooled at all. Nice work. Best answer, multiple irregular bulging pouches. Diverticulitis, multiple irregular bulging pouches. Symptoms occur when they're inflamed. Itis, inflammation. Yes. Good job. Look at you knowing these conditions. Blank. Next question. This inflames areas of the intestinal walls, causing patches of damage that can reach to the outer lining. This inflames areas of the intestinal walls, causing patches of damage that can reach the outer lining. A, diverticulosis. B, irritable bowel syndrome. B was irritable bowel disease. C is irritable bowel syndrome. And D, Crohn's disease. when we manage the stress, we manage the condition. Gastroenterologists, the doctors, will tell you straight up, stress is a major factor in irritable bowel disorder, irritable bowel syndrome. Yeah, stress is the major cause of flare-ups. Yes. And so when, as a massage therapist, we can manage the stress, we can help to manage the flare-ups. Yeah. Well, at this point of our lesson is when we wrap it up. I'm going to stay on and take questions from our graduates on both the diseases and pathologies of the gastrointestinal tract, and then also lots of other questions usually too. I want to remind you though, my name is Jodi Scholes, and I want to thank you for being here. I'm your instructor for the MBLEx review course, and it's my privilege, my pleasure to go through this review with you to polish that diamond. You are all diamonds. You are your jewels. Be a different jewel if you want to be a different jewel. If you want to be a ruby, an emerald, a diamond, pick your jewel. And just know that by coming to class, we actually polish. We make it shiny. In fact, did you know that when diamonds are polished, they're put into a tumbler? Yeah, they're put into this thing called a tumbler, and like they put a bunch of diamonds in there, and then they tumble. And the diamonds just bounce against each other. Boom, 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 boom. I don't think they make that sound, but but they bounce against each other. And when that tumbler stops, the result is that all the diamonds have gotten smoother. They've been polished. And I feel like that's what we do when we come to class. We jump in, we do some learning about test-taking strategies, about, in this case, pathologies, and we're like, boom, 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 boom. Oh my God, I didn't know what that meant. Oh my God, I didn't know what that meant. Oh my God, I didn't know what that meant. It's okay. That's what you're here. You're here being polished. Yeah. And the result is that you're brighter on the opposite side of class. So thank you for being here. Thank you for making time. I look forward to answering your questions, but for now, I'll sign off and say, see you again real soon. Here we go now.